so we can stick to that hour presentation. I know everyone wants to get home, get out from the office. So, well, what was that?
I don't have to go very far. I am home.
I have a long drive.
I wish I was so lucky. Okay, so thank you so much for joining MACC's virtual membership meeting. If you don't know who I am Allison. I'm the account manager for MACC. I'm just going to run through some features of Zoom. I know everyone's probably a professional Zoomer by now, but just in case if you don't, I just want to go over a few things. Chat is at the bottom. If you just run your mouse across the screen, it will bring up the bottom bar. Use the chat. Do not be scared to ask a question. Use that to talk to anyone who's in the meeting. Please use the chat. I will also be looking at the chat if anyone has questions. Also, if you want to raise your hand, you can go to the participants button, which is also at the bottom, right next to the chat, and you can click on your name and you can raise your hands. A little blue icon will come up to the bottom right of your screen, which will signify that you have a question. That is pretty much it. Please keep yourself on mute if you are not speaking and let the presenter speak. Get a lot of background noise, so that negates that. Pretty much that is it. We have an awesome presentation tonight. We have Paul Garrison from the Hammond Group and a few of his colleagues that are going to go over COVID updates. And that's pretty much it. Paul, it's all you.
Thank you. Thank you, Allison. I appreciate it. And hi, everyone. Good afternoon. As Allison said, my name is Paul Garrison. I'm with Hammond Safety Management, we're group managers. And I've been in this industry for around 40 years now. I started when I was 8. So, I just wanted to go over everything that we can with the workers' comp industry, where it is now with the COVID. Look, we all haven't been hidden under a rock all this time. For the last 6 months, we've been under a strange cloud. We've been walking, I can say for myself, walking in the city to see a client on a Monday, and on Friday I'm hunkering down looking for masks, you know, and toilet paper. So I mean, that's what it's come to. The new thing is also with the terminologies. Now we have some new phrases that we have to learn, like remote workplace, virtual meetings, virtual classes, distance learning, social distancing, webinars. I mean, think about PPE. PPE was just when you go on a job site, PPE. Now PPE is entered into the private sector, into civilians. Everyone knows PPE, and not just the United States, around the world. So it's new world, as they say, especially with OSHA changes. And, you know, we're finding out that they're really going intense, which Tony and Alan will go into. I found out that that Zoom is not just a lens on a camera. It's now you can get in and talk to people, which is great. I know we used to do FaceTime, but this is fantastic what we can do. So, you know, now, and also school. I mean, you know, my daughter's a teacher in high school, and I was asking her about the classes and everything, and she was trying to explain to me, and I just told her, hold off. I mean, I can understand a blueprint on a GC better than this, because this is insane. Who goes, how many hours in work at school, how many hours at home? It's just, it's crazy. You know, so, and vacations, what's a vacation? We haven't done that in a long time, but hopefully we'll get to that soon. So, you know, reminds me of, I don't know if some of you guys would know, remember the Grateful Dead, there was a song they sang, and I think it sums it up perfectly. What a long, strange trip this has been. So I think that's just about it. Well, let's get started. I want to introduce the people that are on the panel today. They've been in there with the Hammond Group now. The first one up will be Elizabeth Wolfsky. She's a licensed insurance broker who specializes in the workers' comp underwriting field. She has been with us for over 10 years, and she'll be doing underwriting. She'll be talking a little bit about that. Garrett Wilson, who's he's our claims manager. He has been doing this for over 15 years, and he has the affiliations, and he's AIS and AIC and all those alphabets. So he's been around for a while too, and very knowledgeable in the claims department. And also the claims that we do would not be for the first responder. It would be basically for the groups, which would be construction industry, woodworking industry, building material dealers, things like that, lumber. Then we have Tony. Tony has had about 45 years in the industry. He's a CSR. He can go do the Code Rule 59. He's a certified safety. He's associated with the ASSP. He's an OSHA trained certified trainer. He was a licensed contractor superintendent. So he has quite a bit of knowledge on that. And we have Alan Faxon, who has 9 years of working at with safety, and I'm including the safety that he had to do for his when he was in the Marines and stationed in Iraq and Benghazi, because he needed a vacation and he wanted to go where the sand and the sun is. So when you have a platoon of 30 Marines, it's a good start to keep them safe, and he's doing a good job for us, and I'm glad we have him. We're very fortunate. So to start, I'm going to give you Elizabeth now, and she will go into the underwriting concerning the COVID-19 issues. Elizabeth, all yours.
Okay. Hi, everyone. So the first topic I'll discuss is the new classification. The New York Rating Board recently introduced a new classification, code 8873, for temporarily reassigned or idle employees. This classification would apply to any employee who was either working from home or who you were paying while they weren't working, regardless of their actual classification. So if you had a PPP loan that enabled you to pay your employees while they weren't actually working, that portion of their payroll could be classified under 8873. It's important that this payroll is separate and noted in your payroll records so it can be verified when your audit is done. The cost for the new classification is the same as clerical, code 8810, which, as most of you probably know, is a very low rate. So updating your policy with this information can reduce your premium. Does anyone have any questions on that before I move on to the next topic? No?
So anyone would be eligible for that, right, Elizabeth?
Yep.
In this industry that we're talking about now?
Oh yeah, anybody. So next, I'm going to discuss payroll changes. Many companies have experienced significant decreases in payroll due to the pandemic. Since your workers' comp policy is based on payroll, it's important to contact your insurance broker or carrier if you see that your payroll has changed, so that you're not overpaying and so that you're paying an amount that is accurate and affordable to your current situation. So if your business is slowed, if you laid off employees or cut back hours, you could have your policy adjusted. Does anyone have any questions on that part?
Elizabeth, I'm sorry to go backwards for a second, but I have a question for you on the code. At time of audit, and I should tell you I'm an insurance broker myself and a member of ACCA. At time of audit, there's got to be a separation of that, those employees that did work at home or did not participate in their governing code, correct?
Right.
All right.
Right, so that the auditor can, the auditor has to be able to see it and verify it.
Thank you.
Anyone else? Okay, moving on to the next topic, which is deferring payments. Many insurance carriers are allowing some form of deferred payments. Each carrier will have their own guidelines and policies, but I think you'll find that most are willing to work with you if you're experiencing financial hardship. The State Insurance Fund just started this month, allowing policyholders who fell behind on their installments or missed payments during the pandemic to spread out the deferred payments in 12 equal installments. Basically, if you didn't pay your installments for the last 6 months, you can now pay off that past due balance over the next year. Does anyone have any questions on that part?
When does that, it may not be in order here, Allison, but that $500 credit that the fund is giving?
That they can apply for anytime, basically from now until the end of the year. It's a credit for PPE. So if you purchase PPE for your company, you can go on the State Fund website, upload your receipts, and you can get up to a $500 credit on your policy. It is a one-time credit, so it does make sense if you're going to purchase more before the end of the year to wait so that you get the full $500.
Yeah,
But that's pretty easy. That you just go right on their website, and supposedly you don't even have to log in. You can just go on and upload your receipts, and that's it.
All right.
Okay.
I'm sorry. Go ahead.
No, it's okay. So the last topic I'll discuss is remote audits. The New York Rating Board is now allowing audits to be conducted remotely. This started primarily due to the pandemic, but it appears most insurance carriers will continue to offer this as an option even after the pandemic is over. This is great news for those of you who hate having to take the time to meet with an auditor in person. The State Insurance Fund has an audit upload system where you log in at your convenience and upload all of the documents that you would normally show your auditor. I've received a lot of great feedback on their system. I even had one insured who described herself as computer illiterate, and she told me it took her 5 minutes to do the whole thing and that it was so much easier and more enjoyable than meeting with the auditor in person.
Yes, and if any of you that had the experience of meeting with auditors,
The State Insurance Fund auditor.
you can appreciate that.
Yes. So that wraps up my segment. Does anyone have any questions now?
Just on the EMR for the future EMR for a couple of years, you know, when they do the audits, as far as when their payroll now is up, would it be better for them to wait for the AP or to do the?
It doesn't really matter because payroll changes aren't going to affect the EMR until 2022, and that'll be the final audited premium. So it is what it is. Whether they adjust it up or down now,
I see.
not really going to matter because the audit is going to finalize everything. But that you won't really see the effect of that until 2022 when that year gets counted in the EMR.
Okay. Any questions for Elizabeth? Anything else? Thanks, Elizabeth. Thank you. Garrett, you're up.
Hi, everybody. All right. I'm the claims manager at Hammond Safety Management, so I'll talk about claim stuff. I got 2 topics to go over. First, I'm going to give a quick overview of the state of COVID-19 workers' compensation claims related to the construction and contractor businesses in New York. Second, and related to the COVID-19 discussion, I'm going to go a bit deeper into what makes a disease work-related, whether it be the COVID or the flu or something like Legionnaire's disease. I'll check for each questions after each section. I have the Zoom group chat window open on my screen, so you can write it there. Also, if you have any burning claims questions that I don't go over here, I can try to address them at the end of my prepared stuff. With that, I'll get started with the state of COVID-19 claims in relation to workers' compensation. I know a lot of you have probably heard a lot about COVID-19 over the past 6 months or so. I'm sure a lot of you are almost as knowledgeable about it as I am, so I'll try to be brief with this stuff. The most important takeaway about COVID-19 claims I can give you is for workers in the construction and contractor fields in New York, there's an almost zero chance that one of your employees could successfully pursue a workers' compensation claim for COVID. It's not saying that a worker couldn't try to start a new claim for COVID, but any claim that is started will be automatically disputed by their insurance carrier. COVID-19 is handled the same fashion as any other disease claim in New York. I'll talk about that a bit more in the next section. But in New York, no new legislation has been enacted specifically making COVID claims unique in regards to how they're handled compared to other disease claims. Some states have enacted changes to their presumption laws, meaning that in certain states, COVID-19 diagnosis is automatically presumed to be related to their work activity. Virginia is an example of this. So if you are a citizen of Virginia and you contracted COVID anywhere, it will be automatically considered to be a workers' compensation issue. As of right now, there is no indication that the presumptions rules will be changing in New York. I don't personally feel New York will change either, since New York is in a much better position in regards to the amount of COVID cases now than they were just a few months ago. And Governor Cuomo has made it clear that he doesn't feel that there's any need or necessity to really make any procedural changes of how the COVID claims are currently being handled. Currently, almost all COVID claims are being handled by the New York Disability Department. New York's disability system is a decent compromise compared to something like what Virginia has going on right now, since it reduces some of the barriers to actually receive benefits, but the total amount of benefits are significantly lower. For workers' compensation, you need to have a positive diagnosis and a doctor report indicating the diagnosis is work-related. But with the New York disability system, all you need is basically a diagnosis that you have COVID or even been exposed to COVID in some cases. And again, it's a good benefit for New York, just because if it did go to the workers' compensation system, it would create a huge bottleneck in the compensation system. All the insurance carriers would be litigating it. Everything would just be blocked up. I'm going to stop there. Does anybody have any questions about anything I just talked about?
Well, I just have a comment, if I can. As you said, the governor hasn't said anything about opening up, except for the first responders, COVID cases as being acceptable.
Right. Yeah, I am just talking just to construction and contractors.
But the thing is that I think everyone has to understand that that's today. We all know Governor Cuomo. That could change tomorrow with an executive order. So, this is right now. This is just now that there's nothing. But I mean, we've seen other states and what they're doing, Virginia being one of them. So, we're cautiously optimistic in that. If there is being held in, then I mean, it can be a very inexpensive case, which would be 2 weeks or something if the person is healthy enough, and it's just a period of like a flu, getting over that, and they happen to go to a doctor. If there's underlying conditions, then there's going to be a fight there, and if there's hospitalization, it could get costly, and the ventilator and everything, it could be pretty scary, and there's always the death. So. We're very optimistic, cautiously optimistic now with the construction industry, but things could change in a day, depending upon what kind of pressure that the governor is under. So we'll see what happens. But if we will keep diligent in our defense if there's any claims that are put forth by an employee of the construction industry that is in our groups. That's just what we'll do. So,
and just for the claims I've dealt with, I mean, we have many policies, but in total, we've only seen one COVID claim, and it only popped up a week ago.
Right.
And it was disputed within a day.
Yeah.
So, I don't anticipate seeing too much in construction type stuff.
Okay.
Did you have anything else, Paul?
Not at this time. No.
Okay. All right. I'll move on. So what makes a disease work-related? Regardless of the sickness, whether it be COVID-19 or the flu, cancer, common cold, its compensability in regards to workers' compensation is determined in the exact same way. Like any claim, there needs to be medical treatment. The starting point is always a positive diagnosis from a doctor, as well as an opinion that the disease is work-related. So this needs to be determined prior to moving forward with any test I'm going to explain to you now. The first one, what type of work is being performed? If the type of work causes a person to be exposed to a disease a reasonably amount higher than the general population, then there's a possibility of an occupational disease workers' compensation claim. For example, a nurse working with patients sick with any communicable disease like COVID-19 that subsequently contracts the virus, they could be eligible for a workers' compensation claim. Second test, how did the exposure occur? Instead of a persistent exposure, like I just gave you the example of the nurse of, a one-time exposure while performing business duties could be considered an accident. This could be in contact with a coworker, vendor, client, an object, or any person while on a work trip. A good example of this is if a janitor was emptying a trash can and he was pricked by someone's insulin needle that they threw in the wrong trash. That could be considered an accident claim for potential diseases. There probably would be a lot of medical treatment there for possible diseases like hepatitis or HIV. So the third test, what are the circumstances behind the exposure? It needs to be determined if the worker was exposed while doing work beneficial to the employer and during normal work hours. This is the most basic test performed for any potential workers' compensation claim. Disease claims are handled similar to any more normal type workers' compensation claim, like a back sprain. Finally, the biggest barrier for a disease claim to be found work-related is how widespread is the disease. For a claim to be compensable, the worker needs to be able to identify the source of infection. So if a disease is very widespread, then it'll be impossible to prove the exposure solely came through his or her work activity, unless you're in a position like a healthcare worker. So let's take the common cold, for example. You could easily argue that an employee was exposed to a cold from a coworker, and they may have even had to go see a doctor if it was an especially bad cold. However, the cold is so common and widespread that it's impossible to determine exactly where the exposure came from. It may have been from work, but it could have been just likely from a grocery store or gas station or a train, anywhere. So this is very similar to how COVID-19 is now. Many months ago, the spread was significantly more limited. Since then, COVID was found to have a long incubation period, and some people may have had COVID but never showed any symptoms, but still was able to spread the disease during that asymptomatic period. So, like the common cold, it's impossible to definitively determine where that exposure came from. On the other hand, something like black lung is easily traceable to the source of the infection. If you're a miner working in a coal mine, there's almost 100% possibility that you got that black lung from working in a coal mine. You don't tend to see office workers contracting black lung. But just to reiterate about COVID-19, it's so widespread now that it would be impossible to determine where that infection is. So unless there is an executive order in New York State, COVID will not be a valid workers' compensation claim in the construction and contractor industries, since it's not in their job duties to work with sick people more than the general population. However, I want to point out, I've seen some news stories, business owners actively discouraging mask wearing in their stores with their employees and clients. Although I haven't personally seen it, I could definitely see it argued that the worker was exposed to COVID at a significantly higher rate than the general population. And I could see the Workers' Compensation Board ruling in favor of the employee that came down with COVID and had a significant amount of disability and loss of work from that. So I definitely recommend following the executive orders to continue having your employees continue wearing masks and keeping proper distance. And I'm sure Alan will touch on this a little bit later. But that's all I have today. Does anybody have any questions regarding anything I talked about or any other claims related question?
No? Okay. I just wanted to comment on one thing is with the underlying conditions. I know that, Garrett, you mentioned quite often that timing is very important, especially if you're questioning the validity of a case. And underlying conditions are very important because you will have a carrier, no matter what the carrier is, they're going to, they're under a time restraint. They need information. If you have a judge at the hearing that will say, look, we're going to pay it without prejudice. I don't know if you're going to touch on that, but if you have something that's paid, and I quotate, without prejudice, that's usually prejudiced. I mean, I don't think there's, try to get that money back. So be careful. You have a carrier, whoever it is, or, the group or the fine people I know at USI are on that, but you got to get to them right away and let them know that you have a person that has whatever the condition is, and there are underlying conditions. You have a personnel file with the person. You've heard about that person might be sick, might have had an underlying condition or been sick in the past. You might have some names of doctors and stuff in your file. Anything that you can do that's within the law to let the carrier know, it's good. I mean, going back many years ago, I used to look at the emergency room reports that you come in, and you would gain a treasure chest of knowledge just from the emergency room report, because a person goes to that emergency room, they can give you a description of how the accident happened, which may be different from the description they gave the employer. There's all kinds of possibilities. So, I mean, there's ways that, to defend the employer, and that's really, very important, that we would like to make sure that you guys do get to your carrier, get to your broker, get to whoever your representatives, and let them know this information. Don't think that they'll find it out eventually. Let them know quickly so they don't have to be put in a place where they will go to a court, they're not ready, and the judge will render a decision in saying that under Section 20, what is it, Garrett?
Section 21A.
21A, we're going to pay the claimant now, and we'll sort all this stuff out later. Well, you don't want to sort this stuff out later. It gets harder and harder the longer it is. So try to get all that information as I know it's how easy that sounds, but try to get that information as quickly as possible. I just wanted to throw that in there too. So anything else, Garrett?
Nope, I'm done unless anyone has some questions for me.
Okay, so let's go to the safety portion. I'm going to introduce Mr. Tony Vacchio. Anthony, it's all yours, buddy.
All right. Hi, everybody. I'm just going to share my screen for a second here and see if I can bring up these slides. All right. All right. What we're going to speak about tonight is actually we're going to touch on every one of these subjects here. It's COVID-19 and the impact on the job site health and safety. My associate Alan is going to speak about the employer requirements for employees and requirements at the job site. Just going to touch on the COVID-19 governing agencies relating to fines, which is the DOB, the New York State Department of Health, New York State Executive Orders, which goes to the New York Department of Health, and OSHA compliance. New York City COVID-19 regulations, which I always refer to New York City and 5 boroughs as a different country. They always come up with, above and beyond, they always come up with different regulations. And basic COVID-19 policy and safety plan, right? Right. COVID-19 has affected construction sites mainly with delays. It has slowed things down. The supply chain has been disrupted. But, this kind of stuff we're all kind of used to. These issues, these problems all common to the construction trade. We've always had these, these obstacles and these issues to overcome. The problem with this obstacle is that COVID-19 impacts the employee directly. Right? It has, in some employees, it has instilled fear, and then bringing the COVID, the virus back home to their parents who are elderly, their children, their family, and whatever. So it has caused a different atmosphere on the construction site. So when this thing happened, nobody really knew how to deal with this virus. Everybody, was running for cover on this, and they didn't really know how to handle this. So they try to throw it on OSHA. OSHA says, well, no, we're just compliance. We just make sure they're complying with the regulations that we already have in place. Now, DOB says, well, we just, I don't know, we don't do anything. We don't know what to do on this. So, the federal government put the brightest minds in the country together, and they come up with these regulations. They gave each state, the governor, the power to come up with a written COVID-19 exposure control plan. All right, let me just step on. All right, so what is a written COVID-19 exposure control plan? Basically, it outlines how a workplace will keep workers safe and prevent the spread of COVID-19. Right. All employees should implement and update as necessary a plan that is specific to their workplace. It identifies all areas and job tasks with potential exposures to COVID-19, and it includes control measures to eliminate and reduce exposures. So what does that mean? A lot of guys say, well, how do I do that? But fortunately, if you're a member of our group, we put this all together for you. All right. The state also came up with a template that they sent, and which you would have to fill out. All right. So and it will get confusing to a lot of guys. This has affected everybody differently. I've spoken to many of our clients. I've spoken to clients outside our group, and if you speak to them and you say, well, this has affected me, unbelievable. It's killing me. It's terrible. And I speak to other people that say, well, you know what? It hasn't affected me much at all. I'm just going about my business. I'm following, the CDC guidelines, which the COVID-19 exposure control plan is supposed to be based on. So if you follow the CDC guidelines, you have to put this plan together. But construction workers are construction workers. These guys are working with their hands. They're building. They don't really, it takes a lot of time to put this together. So between the CDC guidelines and the template, samplet that they send us, we put one together for our clients, and which helped them a great deal. All right. Now, going on with this, when this plan is implemented, certain contractors, the bigger guys, especially in New York City. In New York City, they put in policies where they have to take everybody's temperature every day. Now, this takes a tremendous amount of time and effort. You have to put people in place. You need extra help in the morning to do this. And if you got 40 or 50 guys on a construction site, like, some of the projects I used to handle, we used to have 30, 40 guys, and this gets pretty complicated. So the general contractor tries to put this on the subcontractor, but however, the general contractor or the permit holder of the site is responsible for providing all this. They're supposed to provide a washing station on every floor. They're supposed to provide the screenings, the temperature taking, and all that. That's all in New York City. In some other spots upstate, they don't require temperature, but I believe, I'm not sure, my associate Alan believes that this is now mandated. I think it's mandated in New York City. I'm not sure if it's mandated outside New York City, but I don't believe it is. This is something that they go above and beyond. It's called recommendations on the CDC guidelines. So these are, this puts a pretty big burden on the people on the GC to hire different people and to keep track of all this. It also restricts people from going out for lunch. Right? They don't want people going out, mingling with people outside the construction site, then coming back in and possibly catching it outside. So there's a lot of factors in this, and this control plan addresses all these issues. Right? Also, on a large construction site, they need to have a designated area where you're supposed to have lunch, set up in the morning, and either possibly change your clothes, wash your hands. and have your own PPP in your own gang boxes. Now, on the other hand, if you're a small shop, mom and pop shop, you only have maybe 3 trucks, 4 trucks, you have 6 or 7 guys. And you say, well, I don't have to do any of this stuff. My guys are, they're healthy. I don't have to do any of this. But this, you can get pinched with this if one of those guys do come down with it. These small companies also have to have some sort of policy in place before they send their employee into an environment that may not be safe. So if you're doing service calls into a residential home and you don't know if the homeowner had contracted or was exposed to it, it may become an issue to you. So what we suggested, we came up with a questionnaire prior to sending your employee into that environment for them to answer whether they were exposed to a COVID-19 virus, were they tested positive within the last 10 days, were they near anybody that had the virus, and whatever. We have a bunch of questions that we would ask. And I would recommend that you would give that form to the employee and have your employee have that signed by the homeowner. And that's the way it certifies them. So it covers your butt a little bit, and it's following the CDC guidelines. And also, it doesn't put you in a position where you endanger your employee. And actually, OSHA, if your employee files a complaint with OSHA, they're gonna refer to the general duty clause. Everything is referred to OSHA on the general duty clause. They don't have any new regulations in place. OSHA, it takes years for them to put one regulation into force. So they're not going to say, well, no, this is all a new law. Everything is going to be referred to the general duty clause. If I can go back to that, the general duty clause, which OSHA, which states that the employer must provide a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. So everything is going to go there. They're going to refer your face covering to the respiratory plan. They're going to refer everything to the general duty clause, and there's a bunch of things in there that they can pin you to. All right. So you have to. It's almost imperative. It's a regulation to have your own written COVID-19 exposure control plan. If you don't have one, you really should have one together, because if when something everything is fine until something happens. When something happens, they're going to be asking for you for all this stuff. All right. The next item I'd like to speak about is the employee requirements for employees and requirements at the job site. My associate Alan is going to go into that as far as PPE. Go ahead, Alan.
All right. Good afternoon. So like Tony just talked about, one of the big things is just making sure you've got somebody checking on your guys, every day to make sure that they're healthy enough to show up to the job site. Right now, I think if you have a temperature under 100.4, then you're good to go to come to work. It doesn't, you don't have to have someone standing there every day taking it down. Technically, the way it's written is you could have, all of your guys text you before they come to work saying, hey, I took my temperature, I haven't been around anybody with COVID, and that counts. But what you really just want to make sure you have is just some kind of piece of paper, some kind of document on your phone or on your computer just saying, hey, this is my list of crew today. They all checked, we're clear, we're good to go. So I know you've been beaten to death on that. I'm sure you'll all have some type of something like that in effect. And if you don't, it's worth looking into. There's a million different things you can get offline right now with different checklists. The CDC has one, Department of Health has one. So find the one that works best for you and then just go with it. I do recommend that have one employee be in charge of it, whether it be your safety guy, a foreman, or a field engineer, or just someone in the office who's really going to keep track of it. Because like Tony said, if someone comes knocking on your door, it's going to be the first thing they want to see. All right. So I'm just going to touch a little bit on hygiene. Like Tony mentioned, you do have to have a wash station, whether it's on your job site. If you're working on a big job and you're working with a GC, they need to have one wash station per floor. But if you're the one providing in your shop, just know that you got to have soap and water, or you can use hand sanitizer if that doesn't work. If you don't have the plumbing there, that's fine. Just make sure you've got at least 60% alcohol in that hand sanitizer. There's a lot of knockoff stuff being sold online right now, so you really want to make sure you're double checking it. One thing I know OSHA is going to be looking for as soon as they get out there is the SDSs. You start adding stuff like different soaps, different hand sanitizers, they're going to want to see it in the SDS. I know that because I got hit for it once when I had OSHA tour one of my job sites. They didn't knock me for it, but the guy was just kind of giving me, the nudge saying if they want to be that much of a pain, they can. So if you're bringing new chemicals in, new soaps, new hand sanitizers, just make sure you get the SDS and make sure that all of your employees know where that SDS is in case OSHA asks them, because they do weird stuff like that at times. Just one other thing with hygiene right now. They did come out, OSHA and the EPA are now saying that there are a couple EPA registered disinfectants that they're preferring people use for disinfecting their job sites, high traffic areas, lunch areas, tools, that they want you to be using. So as of July of 2020, they only had 2 on the list. I'm sure it's grown by now, but the 2 that I do know about that I know that they're accepting are, it's a Lysol disinfectant spray, and then the other one is a Lysol disinfectant MACC cover mist. So make sure you have those in your shops. If you don't have those, make sure you have something equivalent to it. You can go on the EPA website, it'll tell you right there, but it is something that they're starting to look for. I know, like Tony said, it is the GC's, job to have that for you, but they don't always have it. So it's worth throwing that in your gang box if you've got one on the job site. If you do have it in your shop, make sure you do have it in your shop. And again, make sure if you're buying new cleaning materials, they're adding that to your SDS. If you're keeping your old cleaning materials in there too, which I recommend you do, because in 6 months, nobody's going to care about this, keep those in your SDS as well. So you don't, get in trouble for that as well. That's really it for cleaning and hygiene. I know you guys been, hammered on it. So you just got to keep clean working environments, and you got to make sure you're following the protocol. Sorry, the last thing, when it comes to cleaning, you need to note it down. You need to put the date, the time, and the scope of the cleaning. So whether you have a janitorial staff going, whether you've got laborers on your job site, or even if it's just your own company trucks, you got to have a little tag in there or something like that that is written down saying that you are cleaning, what you're using to clean it with, who cleaned it, and then have someone sign off on it. They are checking that. It's a big thing, especially even if you're just working in your office. You got to have a little tag that says, hey, we clean the door handles on the way in, we clean the bathrooms, and we use, safety gloves, we use goggles, we use face masks. You got to have all that stuff written down. It is something it's not just the general, just sweep up the shop at the end of the day anymore. You got to really make sure that you're protecting your employees. All right, personal protective equipment. I know everyone's got their face masks. That's good to go. Biggest thing right now, if you're working on a job site or you're working in your shop, if you're working within 250 square feet of another employee, you got to wear the mask all the time. So in most of the fields that we find ourselves in, you got to wear a mask all day. You're responsible as either the foreman or the GC or the company owner to provide all of your employees a mask. The face bandanas are fine right now. Homemade masks are fine right now. Surgical masks are fine right now. You just got to make sure that they're clean, then they're taken care of. I know the big problem is that, you get out of work, you throw them in the bottom of your truck, you drive home, it gets covered in mud, you show up the next day and they're asking for a brand new mask. Unfortunately, that's just the pain. You got to keep a good supply of it. Got to keep ordering it, at least for the time being. It's just one of those pains. There's really no way around it. They're walking around and they see people not wearing masks, which I know I've seen. I know Tony saw that today. It's a thing, and eventually OSHA's going to get out there. They need to catch up on all their visits, and they're going to be visiting a lot of sites. So whether it's smaller job site or a bigger job site, it's just, I recommend having extra PPE for your guys. Regular face coverings, like I said, are good to go. You got to make sure that you've got a couple of extra ones. But another big thing to remember is that these face coverings, they don't take away, from wearing the proper PPE when you're working, when you're either, core drilling a hole, you're cutting some concrete, you're TIG welding. You got to wear the proper mask at that time. You got to wear the proper you got to wear the proper PPE. So, and you need to make sure you take off I know it's a joke, but I've seen it. They need to take their bandana down before they put on their proper face respirator. People, for some reason, think they can keep their face respirator on over their mask or put their mask over it if they're sharing a mask. It doesn't work like that, and you'll get knocked for it. And then you are just getting yourself, you're breathing in whatever your body was just holding in. So face coverings do not take the place of other pieces of PPE is kind of the point I'm trying to get across there. The next big thing is the N95 masks, which I know we've got, everyone in the world wants an N95 mask out there. So there are two kinds. There's the N95 mask, and then there's the KN95 mask. Just be aware of the two different types. If you are giving your employees the KN95 mask, it'll say right on the box, those you do have to be fit tested to wear. If you're wearing the N95 mask, you don't have to be fit tested to wear unless it's unless you are the employer and you mandate it, which you can. They can be fit tested. They're both pretty much the same. They filter out about 95% of the stuff we don't want to be breathing, whether it be silica or bacteria or any of that fun stuff. So both are good to go. Just make sure that if you are wearing your KN95 mask, you do have them fit tested, because OSHA knows the difference. Just a little side note with the KN95 masks, there's a little bit of talk going on about them. Most of them have those little one-way valves in the front, which at the end of the day, it's kind of defeating the purpose of wearing one, because when you wear a mask, you're doing it so that the droplets out of your mouth don't go all over your workplace or on your coworkers. So that one-way valve, while it makes it a little bit easier to breathe out, actually just spits those droplets all over the place. So if you are just wearing them for protection, you're really not doing yourself or anybody else any favors for wearing them. So I do recommend wearing the N95 masks. And the N95 masks are made in the United States, and they do have a little stricter rules and regulations on breathability. So if you have some older employees or employees that have breathing problems, it makes it a little bit easier for them to breathe. Do we have any questions just on the masks real quick? I know there's a bunch of different kinds, and if anybody wants to know anything else about them.
Alan, let me just ask one thing.
Yeah.
You were mentioning about the masks, and I think there is also a mask, that the counterfeit one that indicates the child that it's approved for children or certified.
Oh yeah, so there's so the CDC sent out a big warning about a lot of masks that are being flooded into the market right now. They've even been found at some hardware shops. They really have been found at like a Lowe's or Home Depot. But there are counterfeit masks. Some of the big telltale signs are no markings, or they'll just have loops around the ears, and then it looks like an N95 mask. They don't do that. All N95 masks have the straps that go around, the back of your neck and your head. They never have any loops. They're lacking in numbers, and showing you who the manufacturer is. And like Paul said, no company makes N95 masks for children. Both companies that make the N95 mask here and the KN95 masks both say that they'll never certify a mask for children, because it's impossible. The kids are, too little, too small. You just couldn't do it. So any masks or a box that says that is automatically, it's fraudulent, and they're not certified, or you don't even know what they're protecting you from. So you really want to be careful with that. Any other questions? I know I threw a lot at you, but those are just kind of the smaller things that I noticed that are really changing for the construction industry. And you really want to just keep your eye on the news and really check the OSHA boards and the CDC, because things are changing every single day. Like Tony was saying, down in New York City, I know there's a lot more. You need to do temperature checks. No ifs, ands, or buts. Up here, not really so far. Maybe it will happen, maybe it won't. Just kind of in the Buffalo, Syracuse area. It really depends on where you're working at the moment.
Not to harp back on the masks, but if an employee will say, if you offer him a mask and he says, I have my own in the truck, or I have my own, take a look and see what it is that he has. Be cognizant of what he's wearing as well. Maybe he's not wearing the appropriate mask, or the one that you want him to wear, or maybe the mask to look like it's been through 2 wars. You want to check that stuff out and make sure that he's doing the right thing. Don't take their word for it. Alan, am I close to correct?
Oh yeah, definitely. Right now it's pretty broad on what you can wear at work, but if they're coming in with a napkin tied to a rubber band, not really going to fly.
Oh, you saw my last mask. Okay.
That's good, Val. Thank you for that. You know, like Paul says, these masks, the employer is supposed to ensure that the proper PPE is issued to the job site, and there's plentiful supply, right? You're supposed to have enough supply on the job site to make sure that they can change their mask if it gets dirty during the day, especially if they're going from just a face covering to a ordinary respirator if there's a welder or whatever, right? I just want to touch on these other things because I know we're getting pressed for time. The governing agencies relating to fines, the minimum fine in New York City or basically anywhere, I believe it's going to be $5,000 for any kind of I'm missing the word, but any kind of violation, right, to the New York State executive orders. All right. If the DOB comes onto your site in New York City, first thing he's going to be asking for, he's going to be looking for disinfecting logs. He's going to be looking for the logs for temperature checks. He's going to be looking for the health screening logs, the questionnaires, and he's going to be looking for basically paperwork. If the New York State Department of Health enters your job, he's going to be looking for the logs, more or less the same thing. All right. The logs, the paperwork, it's all going to be related to the COVID-19 virus. DOB is going to be looking for the stations for hand washing. You're going to see the hand sanitizers and whatever. Excuse me. But if OSHA enters your job, all right, who is only looking for compliances, all right, OSHA areas of focus is going to be whether the employer has a written pandemic plan, which is the written COVID-19 exposure plan. That's the first thing OSHA will ask you, all right? They're going to be looking for social distancing protocols. They're going to be checking exits and entrances to see if they're monitored, to see if people can come and go freely. They're going to be checking common areas, lunch areas, break times, shift changes, restrooms. They're going to, and everything on that. If an OSHA guy comes on your site, it's because somebody called or something is happening or he's just maybe wanted to stop by. These guys are really not coming out for just a casual visit. They're going to come out because they were called. They're going to be called because an employee got spooked. He's not satisfied with the way things are going on the job, and he'll call OSHA. And there's a tremendous amount of things where OSHA can tie this to the general duty clause. They'll be checking on personal hygiene, including hand hygiene stations, identifications of high touch area surfaces. They're going to want to know how that's being taken care of. Cleaning and disinfecting procedures. They're going to want to know that. Use of EPA registered disinfectants. They're going to be, as Alan mentioned before, employee access to SDS sheets. All right, very important. That's something that they've always done, but they're going to focus on that a little bit more. They're going to check to see if there's an adequate supply of PPE, what the proper care of, the maintenance, how it's being used, instructions, if the employee was trained. Okay, signage. They're gonna look for signages. They're going to be looking for areas of restrictions, warnings, path of travels in certain areas. If you do any work for the school construction authority in New York City, they're extremely strict. Right? They're gonna ask for path of travel routes. They're gonna have you put arrows on the ground. They're gonna have one stairway designated for up, one stairway designated for going down. They're gonna be looking for signs for reminders regarding social distances, the use of masks. Additional areas they're going to be looking for: employee communication and training, prevention on how to prevent from contracting the infections, symptoms and control. That training is very important. Employers must sit down with the employees, have a meeting, and communicate how this virus is being transmitted. A lot of this fear is not knowing the unknown. So the more information they know about this, the more calmer they'll get. Their nerves will, you can ease their nerves, you know. It's imperative. And OSHA requires that employees be trained on how to prevent contracting this virus. Okay, screenings, testing, at-home facility entrances. If for any reason you operate your business at a home, they want to know how that's being operated. If OSHA should visit you. All right, respiratory protection program, you must have one in place. And all this stuff for our clients, we help them tremendously with this. We provide the respiratory protection plan. We set up these plans as these site-specific plans on each job, because each job is separate. Each job has different issues that they have to deal with. So they're also going to be looking for that. So they also want a return to work procedure protocol. So if one of your employees had the COVID-19 or if he was infected, what was the procedures of getting him back to work? All right, need to have procedures in place for that. Engineering controls, they're going to want to look for what kind of engineering controls you have in place, which is barriers, dividers, anything of that nature. Administrative controls, they want to know if they're going to have any of that stuff in place, which consists of staggering work shifts and on, I guess, stuff on that line. All right. They're also going to be checking whether an employee follows CDC guidelines, and that's very easily known. You can look, you know, I can walk on a construction site and just take a look, and I'll know right away if they're following CDC guidelines. And last and foremost, OSHA required record keeping. All right, they're really big. You know, the government, the federal government is, you know, their motto is if it's not written down, it's not being done. So you need to record all this stuff. And you need to keep it. This stuff needs to be kept for at least 5 years, believe it or not. So, because employees can bring up a claim. I don't know, Garrett, maybe how long does it take? I've seen claims come up maybe 5 years later that they come up with a claim, you know. But you know, this virus affects everybody differently. It leaves behind other organs that get damaged, and who knows? Our lawyers are all gearing up for you know, how to fight this, how to get the money out of the insurance companies. So, you know, stay tuned for this, because this is going to continue into, I feel it's going to continue into many months and years to come. OSHA also is going to get involved in this as we speak. They're all brainstorming right now on what new regulations they can set forth to make it more complicated for you guys to work with. You know, so my most important recommendation is that you have a written COVID-19 exposure control plan. That's first and foremost. At least that's something OSHA would see, that you are making an effort to comply, making an effort to ensure your employee is working in a hazard-free environment. All right. I know we've gone a little bit over, so I may just stop right there. If anyone has any questions on any kind of this safety or any kind of protocols that may go on large construction site, medium construction sites, mom and pop shops, you know, small construction sites. It just seems like, you know, they've labeled construction as essential businesses. So, I mean, plumbers are essential. You know, you need water, you need heat, you need, you know, broken water heaters. You guys go in, it needs to be fixed. Air conditioning and certain homes need to be fixed, especially in the elderly facilities. If air conditioning go down, you need to get in there. So before your employer will send an employee into, for instance, a health facility or an old age home, assisted living home, you know, you need to have some protocol before you put your employee in that environment. So I would be very careful before I would send anybody in that type of environment. That's
Tony,
basically it. Yes, sir.
Tony, I just noticed there's a question from Stephen Pallone.
Hold on, I don't see it.
I'll read it. I'll read it to you.
Okay.
It says, I know OSHA 40 is now required. Do employers need to pay for this course for all of the employees?
Yes, employees must provide the training. Employee is responsible for providing the training and paying for it. All right. It doesn't have to be on your time. It can be on their time, but you need to pay for it. The OSHA 40, by the way, has been extended to March of 2021, only because of the pandemic. They extended it. It was supposed to go into effect as of September 1st of this year, but they have extended that to the March of 2021. Now, if your employee has the OSHA 30 already, all he needs is an additional 10 hours, which consists of 8 hours of fall protection and 2 hours of drug and alcohol awareness. All right, and that gives them the 40. If you have supervisors or superintendents who are running job sites, they need 62 hours of OSHA training on that. And I'm not sure that has not been pushed back. So right now, supervisors, guys, are jobs that require a superintendent. All those guys need to have 62 hours of, it's called an SST card. Right.
Allison, I don't know if there were any other questions. That's the only one I saw.
Nope, I think that was it. Unless anyone wants to hop on right now to ask a question, that was it in the chat.
Okay, that's about it. That training is being strictly enforced. By the way, that's only within New York City. Once again, I call that a different country. The New York City and the 5 boroughs is the only place that is requiring the SST card. Anywhere outside New York State, you don't need that. The OSHA 10 is if you have an OSHA 10, you can work on most federal and state projects outside the 5 boroughs. OSHA 10 is sufficient for working on those sites. I'm not sure in other states. I know Oregon has pretty tough. California, OSHA Cal is tough. Virginia is also tough. They've already implemented some new OSHA standards there.
I think there was also something about the Hamptons. I think they were going above and beyond the 10.
Yeah, well, that's certain municipalities, certain villages. Yeah, they can. OSHA is like the minimum. The minimum. It's the minimum requirement. But any municipality, any village, any town could exceed the minimum. They could say, hey, no, you want to work in my town, you need 30 hours of OSHA training. All right, so that's true. But if the GC is requiring that your guys need to have an OSHA 30, OSHA 40, or they need 100 hours of OSHA training to work on my site, then that's the deal. That's the contract. That's the deal you made with the devil. So be careful on what you're signing with these contractors, because some of the big guys like Turner, Hunter Roberts, Gilbane, Shawmut, all those guys, they're adding a lot of additional restrictions on these jobs. Some of them are banning wood step ladders. Some of them are requiring you to have fall protection while you're on a step ladder. I mean, some of these things are off the wall. But you need to be careful, because a lot of these contractors are getting involved, and they come back to me and say, "Oh, I've never heard of this. We need our guys to have training on use of a ladder." Yeah, there is training on use of a ladder. If they require it, then you got to provide your employee with that training. So a lot of guys are exceeding the minimum requirements for training on certain jobs. I think that's a pattern that you're going to see develop throughout the state eventually. Slowly but surely, that's going to develop throughout the state. They're going to require more OSHA training.
Thanks, Tony.
All right, perfect. If anyone doesn't have any other questions, that is it for us for this evening. Thank you so much to everyone from the Hammond Group. Really appreciate this presentation.
Thank you. We appreciate it. Thank you for the opportunity. And anybody can call us, if they want any other questions, we'll be glad to answer them.
Perfect.
Thank you very much.
Perfect. Everyone stay safe. And thanks for joining again.
Careful driving out there.
Thank you.
Bye-bye.
You all good, Paul?